So I'm going to move on now to our first scenario. So our first one is about pragmatic care, and by pragmatic care I mean where in an ideal world you would do further investigations, or you're presented with an animal that needs surgery, but the client's financial means would not stretch to that kind of treatment, and you have to make decisions that are different to what you would do in an ideal world, but on a pragmatic basis, so you can still improve the health and welfare of that animal, but within the means of the client's financial situation. So that's what I mean by pragmatic care. And Izzy Hocking has kindly outlined a scenario where she had to deal with this exact type of scenario. So Izzy graduated from the University of Liverpool in July 2018. She took 6 months off after graduation to volunteer awards for veterinary charities. She joined the Blue Cross graduate scheme in January 2019, working in both London and in Grimsby. And since completing the graduate scheme in July 2020, she's been kept on as a vet at the Blue Cross in London. So Chloe, could you please play Izzy's video, and I hope everyone enjoys it.
So my name's Izzy. I'm a vet working for the Blue Cross. I graduated from the University of Liverpool in 2018, but I didn't start working until 2019. One kind of tricky situation that I faced quite early on in my career was a case that we will all see, you know, several times a week from day one in practice. It was a young dog that had been vomiting for 24 hours. Came into the clinic, was quite bright, not particularly dehydrated. I did my basic physical exam, wasn't too worried, thought probably he's just eaten something disgusting. And because we're a charity, we tend to have a pretty pragmatic approach to these cases. So essentially, I decided to give him some antiemetic, pain relief, and told the owner if he wasn't doing better within a couple of days, bring him back and we might need to do some more tests, which is something I had done loads of times already. And most of the time, the animal gets better. In this case, they didn't come back, which initially you think, great, it worked. But then the dog came back about 10 days later, really, really unwell. And at that point, we did some bloods, and the dog had really severe kidney failure. Obviously, I felt terrible anyway. And then the client expressed that they'd like to complain about the case before we'd even kind of worked it up. I felt awful. I had to do a written statement for my boss about why I'd made the decisions that I had. And I really kind of lost confidence. Once we worked up the case in our hospital, it actually transpired that this young dog had polycystic kidneys. So it at least made me feel like, well, it wasn't that I totally missed something, you know, or could have necessarily changed the outcome, but I still felt really, really bad. And the dog got worse and had to be put to sleep. As chance had it, I was the vet who put the dog to sleep with the owners, and had to kind of talk them through everything because they remembered me, which I was really worried about doing. You know, I felt really embarrassed and awful that I'd caused such unhappiness. But actually, by doing the euthanasia, speaking things through with them, they actually kind of understood my viewpoint, came around and just realized this was just a rubbish, really sad situation rather than anyone's fault. And they actually retracted the complaint. So, I mean, things that I learned from it, I did lose some confidence. And after that, every time I saw a vomiting dog, I thought, oh, should I do a blood? Should I not? I don't know. And in charity practice, you know, we have to be mindful of costs. So it was quite difficult. But I guess what I've really taken from it now is if I say to an owner, oh, I'm going to give him some meds, come back in a couple of days, I really, really stress the come back in a couple of days. You know, I might say it 2 different ways and then summarize the consult twice to make sure they've really understood, do come back if it's not getting better. And then I think as well, I learned that you shouldn't shy away from cases that have been difficult and owners that have made complaints. I think it's as important to keep the channel of communication open, because I think the more that they understand you're a normal human being who might have made a mistake, the less likely they are to kind of feel really angry towards you, because these people really warmed up once they'd had a proper chat with me. And looking back, I don't know that I would do anything particularly differently other than stress, please come back if he's not getting better.
Hello everyone. So hopefully now you've got my my slides back. So that was Izzy talking about her scenario to do with offering pragmatic care. And I wondered whether any of you had some thoughts, any thoughts on that scenario. So you can either say in the chat or you can pop your hand up and tell us all about it. So did any of you have any thoughts about what Izzy was just discussing? So, for example, would you, in the situation that Izzy was put in, where she knew that the client had limited means, and so she offered a pragmatic approach to deal with the symptoms that the animal was presenting with, would you feel comfortable doing that in the same situation? Is that something that you might find difficult? Yeah, so we've got Jen in the chat says, I think it's really important to keep talking to the client after they've made a complaint. That's absolutely right, and demonstrated by Izzy's scenario. So one thing we do see at the RCVS is that communication with clients is absolutely key, even when you have maybe you might have made a mistake, or maybe you haven't and just something's gone wrong. If you have good communication with your client and you are empathetic and you try and explain things as best you can, we don't see complaints coming through. We see complaints coming through sometimes where things have gone fine, but the communication has not been so great. So good communication can be a really good way of avoiding complaints and also resolving issues once they've arisen. So absolutely agree with that, Jen. Yeah, so Natasha in the chat says, I've similarly found it really important communicating a timeline for owners, i.e. I want to see an improvement in so many days and if not, come back, and taking it for granted that your knowledge and understanding about things having improved. I think that's absolutely right. So kind of really making clear that that you really do need to come back if things aren't right. Yeah, and Mary saying a stepwise approach to the treatment, i.e. symptomatic initially, but if no better, we'll do X, Y, Z, helps in situations like this. Yeah. So it sounds like lots of you have either been in a situation quite similar to Izzy, or that you might find yourself in, or if you found yourself in a similar situation, you might do something the same. I wondered if any of you find these kinds of situations uncomfortable or difficult, kind of discussing those pragmatic options. Yeah, Ellie says in the chat about you would feel the same as Izzy and feeling guilty afterwards. And it's interesting that I think a lot of vets that we speak to who find themselves in situations like this, they often feel like, oh, if only I could have done more, maybe I should have done something differently. But, you can only do what you can do in that situation with the animal as it presents. Give the owner the best advice you can and hope that they follow it. But I think it's completely natural to feel slightly uneasy after something like this. So I thought we would round off the scenario by just looking at the code and seeing which parts might be relevant to this scenario. So hopefully you can all see it. So firstly, we've got here, veterinary surgeons must make animal health and welfare their first consideration when attending to animals. And that's obviously the absolute fundamental tenet of being a veterinary surgeon. That you must provide veterinary care that is appropriate and adequate. So, and in my view, providing a veterinary care that is appropriate and adequate also means taking into account the whole circumstance of the client's situation, so their finances as well as the situation that you're presented with. And the last one there about veterinary surgeons must respond promptly, fully and courteously to clients' complaints and criticisms. So that feeds into the point that we're discussing about kind of keep talking to the client and address those issues. Don't shy away from them. And the supporting guidance within chapter 2 veterinary care also talks about specifically about that kind of pragmatic care issue. So veterinary surgeons should make decisions on treatment regimes based first and foremost on animal health and welfare considerations, but also the needs and circumstances of the client, and recognise the need in some cases to balance what treatment might be necessary, appropriate or possible against the circumstances, wishes and financial considerations of the client. So this is something that we do provide for within the supporting guidance. We do recognise that people's means and financial situations do have to play a part in the kind of care that you can offer them. So I think we can move now to our second scenario.
Emma, sorry, could I interrupt you?
Yeah, of course.
We've had some questions come in on the Slido about the case study. And one of them would be, what would have happened if the complaint had progressed?
Okay, so, well, it would really depend on who they complained to. So at that point, Izzy, I think, was talking about, I think Izzy might be here actually, so she can correct me if I'm wrong. Izzy's talking about a complaint coming into the practice, so I guess it would go through their own internal complaints procedure. The person may be interested to know what would happen if a complaint or a concern is raised with the RCVS. So what happens then is they raise a concern, they fill in a form, and the RCVS will investigate that complaint, and that will involve talking to the complainant, talking to the veterinary surgeon involved, and trying to work out whether what's happened falls seriously below or far below the standard expected of a veterinary surgeon, and that is really quite a high bar. So they are looking for not something that's negligent, something even further below that. So the bar for complaints progressing out the RCVS is quite high, but it will be investigated to determine whether it crosses that threshold or not, in essence. I hope that answers the question.
I've got another one, Gemma. Is it the owner's responsibility to bring the dog back, or is the vet at fault?
It's the owner's responsibility to bring the dog back. I don't think there would be anything wrong with a vet following up if they wanted to, but it's the owner's responsibility to seek appropriate veterinary care.
That's great. And there was another comment just saying that it's really difficult to ensure the owner does come back, even if you physically give them an appointment. Yeah. Totally would have done the same about treating.
Yeah, absolutely.
That's it from me, Gemma.
Okay. Thank you. And thank you for the questions. Really, really good ones.